Hey class, welcome back. I hope that you have continued to stay safe and healthy during this crazy time in the world. The weather today is not looking so great, but we've had some pretty great days in the last couple of weeks, and if you haven't done so already, I encourage you to actually leave your house and take a walk, maybe around your community, or if the nature trails are open, go there. I mentioned a couple of weeks ago that we have sort of forgotten about our mental health and we've been focusing heavily on our physical health, but really health is not just washing your hands and eating right and getting sleep, but it's also mental health. Making sure that your stress level is at a manageable rate, keeping yourself just calm, collected, and ready to kind of take over the world once the world opens back up, at least. I'm not sure how informed you guys are, but I want to make sure that you are informed. So I'm going to take a second to talk about some changes that you might see happening in the community starting on Monday. And this is a statewide change. This isn't just a Covington area change. Now, on Monday, May 11th, the first phase of the businesses reopening in the state of Kentucky will begin. Our Governor Andy Beshear, has highly advised that if you plan on going out in public at all, to get a face mask and face covering of some sort to wear while you're out in public. And a lot of businesses, at least according to the news, have straight up said that starting on Monday, you cannot enter the building at all unless you have a face covering of some kind. So I'm going to link a video that was created by the CDC that actually walks you through how to make your own face covering using materials that you should have lying around your house. If you're on my YouTube channel, I will link it in the description box below. If you're on my Google Classroom page, I'm going to link it to the morning announcement that I have. I do also want to kind of remind you that if you maybe have a couple of extra dollars lying around and you want to help people out, there are some amazing crafters online, Facebook Marketplace and Etsy especially. I ordered 2 masks from Etsy specifically. I had this one custom made and I thought it was hilarious when I made it. It came in the mail, so excited to open it up, and then I wore it and I was like, it's not actually that funny. Welcome to my life. So it just says for Andy, as in Andy Beshear, because I've been watching his daily COVID-19 updates and he's like an uncle to me. He's got this, he's super awkward. I don't know if you've seen him, and it's just, he cracks me up even though I don't think he's trying to be funny. So if he asks me to wear a face mask, I'm going to do it. And then I have this one that is aliens and pizza and planets, and the only reason I really bought this one is because it glows in the dark. And I'm an actual child. This one was $10 and this one was $15, I believe. And again, these are kind of the better ones out there. They have some really cheap ones on Facebook Marketplace for like $1 or $2. The reason I encourage you to kind of buy it that way is that it helps to support families that maybe are relying on the money made from the mask to buy food or to, stay afloat during this crazy time. Okay, so with that out of the way, let's actually go into our lesson for today. So we started Tuesday on comparing COVID-19 to the Spanish flu of 1918. And I went on a little bit of a tangent and talked about how the Spanish flu is actually named incorrectly because it didn't originate in Spain. However, I'm going to kind of backtrack a little bit and I'm going to continue to call it the Spanish flu. 1, because that's what most people refer it to as. And 2, it's just much easier to say than the influenza of 1918. So for the rest of this video, it's going to be the Spanish flu. Today, I'm actually going to continue on with that comparison. And specifically, I want to look at race and how the people of different races had different experiences during the pandemics. And obviously, we are still going through the COVID-19 pandemic. So the statistics that I'm going to be sharing today could change at any moment. We won't know the true outcome of all of this until it's all done. So keep that in mind when I talk about specific statistics on comparing back then in 1918 to the current day. But before I begin that, I want to talk a little bit about statistics, so that way you kind of understand how it works, so when I get into the deeper statistics, you get it. Let's say that I opened up a gym, and I want to see the proportion of men and women who actually go to my gym. And I found out that 65% of the people who are members of my gym are men, and 35% are women. If I wanted to look a little deeper, and I wanted to study the statistics or the percentage of men and female in a specific class, say yoga class, I might expect those statistics to be exactly the same. But when I go into the yoga class, I find out that 70% of the people who sign up for a yoga class are women and only 30% are men. I can see that there's much more women proportionally in yoga class than you see in the general gym. If I want to find out why there are way more women than you would expect to see in a yoga class than men, I might want to do further research on why women are more appealed to yoga than men. There is always a reason for these differences. Statistically speaking, you would expect those to be exactly the same, and when they're not the same, there's reasons for that. Let's kind of move away from my example for a moment and talk about a study that was released by the CDC about a month ago, on April 22nd, 2020. Similar to how I've just kind of had this example of men versus female, they wanted to look at the race of people who are currently hospitalized for COVID-19. And they found that 45% of those in the hospital currently suffering from COVID-19 are white or Caucasian, while 33% are African American. So I'm only using two races here, and in case you didn't know, there are more than two races in the world. So that's why when you add them up, it's not going to reach 100%. And that looks normal, that looks fine. But when you compare it to the general population of the community around the hospital, that's when you see differences. When looking at the racial makeup of the community around the hospital, 55% of the people around the hospital were white or Caucasian, and 18% were Black or African American. And just like when I was in the gym and I found out that there were way more men than women who are members of my gym, and then when I went into a yoga class, I found out there are more women than men in the yoga class, and we were kind of using that example to show that there was a reason for that, and we needed to figure out what that reason is. Now, the CDC is seeing this difference. There should be way less African Americans in the hospital than there currently are. If I'm working for the CDC, or I'm a doctor, or a politician who wants to solve the COVID-19 problems, I need to look at the reasons why you see the differences between the community of African Americans and those in the hospital. I need to ask myself why the African American population is at a higher risk of COVID-19 and the factors that contribute to that. And then, have those factors always been there? And for our class, we're actually just going to go back and kind of glance at some of the factors that we see in 1918 in the Spanish flu. Today, I'm going to go through 3 different factors that might help you to see why you see such a difference between the racial makeup of people that are hospitalized for COVID-19 that are white and Black. I will discuss first what these factors looked like in 1918, and then I will go into some statistics from the CDC during the 2020 COVID-19 pandemic. For your assignment today, I want you to choose one of the factors that you think contributes the most to the problem that we're seeing with more African Americans being hospitalized than we should expect. And I also want you to think of some way that either a politician, a businessman, a governor, someone who has any control in society can try and fix that issue. And this is not one of the factors, by the way, but I'm going to use this as an example. The population of Black homeless men are much higher than white homeless men. So when you're building a plan on trying to find a way to kind of solve that issue, you can say that, like, we need to build free or affordable housing so that they won't be homeless anymore. So the first factor is living conditions. This was just the end of World War I. Racial segregation was not only common, but it was legal. And African Americans were prevented from living in certain communities simply because of the color of their skin. You could not live in a community unless it was deemed a Black community. And oftentimes these communities were very cramped, falling apart, dirty. They didn't get a whole lot of attention from the government, so there wasn't like running water or plumbing a lot of times. And we kind of think about ghettos as like this inner city where you see a large number of very poor populations living in. That was created during this time period because they were forced to live in these areas. They didn't have a choice. Even if they wanted to and they could afford to move, they couldn't. And that's kind of going into what we talk about today. Many of the African Americans are still living in the exact same communities as they did back in the 1900s. And although segregation in housing is technically illegal, economic inequality, or the inability to get a good job and to make a lot of money and move out of the ghettos or the inner city, is an issue. And so many people who are born in the inner city system stays in the inner city system. This increase of population and pollution in the area leads to people being born with pre-existing conditions that are preventable if you lived in a environment that allowed for a healthy birth and a healthy childhood. And why it's important is because people who live in this inner city ghetto area have to travel to get groceries and food. And when you have to move around and get groceries, you're at a higher risk of contacting some sort of illness that way. You get on the bus, someone could, be licking their hands and sticking out on the pole on the bus, and you keeping your balance so that you don't fall down could just now make you and your entire family sick. Because when you are in quarantine, you have to be in quarantine for 2 weeks. The quarantine prevents you from spreading the illness to the community, but it doesn't prevent you from spreading the illness to those that are living with you. Let's talk about the second factor, work. In 1918, most of the jobs that were available for African Americans relied on contact with others. You could be a Black business owner, and you would have to be out in your, business talking with customers or making deals with people. Workers for those businesses also require you to kind of be involved with the community. If you work at a corner store, you're constantly going to be talking to customers, moving things around, cleaning up the area, that kind of stuff. A lot of African American women became maids. If you've ever seen the movie The Help is about sort of an African American who is a servant to wealthy white families. And although that movie kind of took place in the 1960s, that same practice of having an African American woman help around the house occurred since before the Civil War. And of course, if there's somebody who gets sick in those families that you're working for, you are most likely to get sick as well. What all of these careers or jobs have in common is that it is required of you to have a lot of contact with the public. And it's much easier to spread the sickness and to be sick because you're constantly surrounding yourself with people. So let's move on to today. Now, I'm sure many of you guys have heard the term essential worker. An essential worker is somebody who is forced to work during the pandemic in stores that are remaining open because they are thought of as being essential to the health and welfare of the community. So you can think of something like Kroger, where you go and get food and you can go and get your medicine from the pharmacy. You need to get food and you need to get medicine to survive, depending on what type of illness you have. So that is an essential business, and that's why it's continued to stay open throughout this pandemic. 37% of African Americans who work are working in a job that is deemed essential. In comparison, 27% of white Americans work in a job that's considered essential. So many of these jobs, and I'm sure that there are some changes that has occurred, but a lot of the jobs don't have paid sick leave and they don't have good insurance. Now, an additional factor into this workforce is the fact that African Americans, on average, rely much more on public transportation than white Americans. And I looked this up. 60% of African Americans rely on public transportation on an almost daily basis, whereas only 40% of white Americans. So even if they're staying at home when they're not working, they're still having to take the bus to and from work, which gives it another layer of possibility to actually contact the COVID-19. Or even spread it further around their community. So then the last factor, health. So let's start in 1918. Due to segregation, most of the hospitals that you can go to were segregated. Sometimes it meant that they would create a Black ward to house the African Americans who were patients of theirs. And a lot of the times, the Black ward would be in like a closet or in the basement, somewhere that they don't use that's probably less clean and cramped. They're going to be closer together because there's not as much room as the white patients would have. Black nurses and doctors who worked in these hospitals were trained less than the white doctors because they weren't allowed to go to places like Harvard or Yale. Additionally, Black areas of the hospital or Black hospitals themselves are going to be a lot less modern. They're not going to have the best technology or the best doctors. And much of the time, you have to travel long distances to go to the hospital. So if you're like having a little cough, you're not going to go to the hospital, you're going to wait a while. And there are also issues of being able to afford to go to the doctors in the hospital when you are sick. And when you compare that to today, you see some similarities, right? Many African Americans do not have access to affordable healthcare. In 2017, for example, 28% of African Americans were uninsured, and that compares to just 16% of white Americans. So you definitely see that racial disparity there when it comes to the healthcare system. And of course, that 28% of African Americans, that's a quarter of the entire African American population, they would be less likely to go to the hospital or to keep up with their health because they can't afford to. Now, due to that, African Americans have a higher rate of pre-existing conditions. Things like high blood pressure, diabetes, obesity, asthma are all super common in African American communities, due in part because they don't have that access to healthcare and they have trouble affording to go take care of the issues that have been bothering them for years. And when you ignore those things, eventually it's going to catch up and you're going to have even worse issues than before. So the three factors that I have that I think helps you to kind of realize why you see such a racial difference between those who are suffering from COVID-19 and how that's kind of been historically the case for quite some time are: number one, living conditions; two, careers and work; or three, health. And once again, I want you to choose one of the three that I just mentioned that you think contributes most to this racial difference we see. And what's something that we can do as a country to help kind of get rid of that, to remove that issue from occurring again in the future? So I will see you again on Tuesday, and after today, we only have 2 days left in class. Isn't that crazy? Again, if you have any questions or concerns, do not be hesitant to get a hold of me. If you're confused about something with this video or the assignment, don't be afraid to message me, get a hold of me, and I will see you again on Tuesday.